When will it all be over? We ask the man who comes closest to being able to answer that question, Dr. Anthony Fauci. Welcome to our special edition of Balance of Power on Bloomberg Television. I'm David Westin. Months after COVID-19 hit the nation, the country and the world are still reeling from the pandemic. Unemployment remains exceedingly high. The 2020 U.S. GDP is down by nearly a third, and over 150,000 Americans have died. Throughout this time, one person has remained the most visible and perhaps the most trusted medical professional confronting the crisis, Dr. Anthony Fauci. Dr. Fauci first came to the public's attention during the AIDS epidemic, becoming director of the National Institute of Allergy and Infectious Diseases back in 1984. In that role, he oversaw the government's medical reaction to H1N1, SARS, and even the terror attacks on September 11, 2001. As the point person for managing the response to the pandemic, COVID-19 might be his greatest test yet. I spoke to Dr. Fauci and asked him whether the pandemic can end without a vaccine. Dr. Fauci, the question I think on everyone's mind is, when will this pandemic be over? And my question to you is, can the pandemic end without an effective vaccine?
I think it cannot durably end in the sense of truly putting us behind us. The classical history of viruses, particularly respiratory viruses, are such that if they are going to be something that is as capable as this virus is of efficiently spreading from human to human, ultimately, if you really want to put the nail in the coffin of an outbreak, you're going to need a vaccine. However, and it's a big however, there are many things that we can do from a public health standpoint that can more adequately control this globally as well as domestically. And they are not particularly complicating things. They are things that we keep talking about, 5 or 6 fundamental principles. Things like wearing masks universally, indoor and outdoor, keeping 6 feet at least distance, avoiding crowded places, outdoors always better than indoors, having a clear-cut fundamental awareness of the need to wash hands as frequently as you possibly can, and stay away from places like bars where you congregate in crowded places. If we universally do that, and one of the problems we have in this country is that the understanding of the seriousness of this as a pandemic varies depending upon what demographic group you're in, because I've never seen an infection like this, where it goes from 40% of the people have no symptoms at all, very heavily weighted towards young people who do really quite well, to people who have minor symptoms, moderate symptoms, severe symptoms, hospitalization, intensive care, and death. So when somebody looks at it, depends upon what you're looking at it from what perspective. If I'm a 75-year-old person with diabetes and obesity, I'm going to be really concerned because I'm at a high risk of a deleterious and severe consequence. Whereas if I'm a millennial who's really quite healthy, you look at the statistics, and even though there's a misperception that those people don't ever get into trouble, they do, and there's more and more examples of that, for the most part, statistically, they do very well. So what happens is that when we talk about the things to do to avoid infection, they understandably and innocently think that, well, I'm in a vacuum, so it doesn't make any difference if I get infected because I'm not going to hurt anybody else. When in fact, even though you may not get any symptoms, what you're doing is that you're propagating the outbreak, and that you will almost certainly, or one of your colleagues will infect someone else, who will infect someone else, who then infects somebody who really, really gets sick. So we've got to all pull together. And the reason I'm giving you that somewhat long explanation is because we can do that if everybody universally does those fundamental public health things.
And one of the messages we're getting from a lot of different sources are we're going to have to do that for some protracted period of time. At the same time, people still keep hoping for that vaccine. And my question is, what is effective in a vaccine? Because what if we get a vaccine that's 50% effective, or it's effective for 3 months or 6 months or something? Then what do we do?
Okay, so let's talk about the percent effectiveness or efficacy, and then durability, because they're really separate, one at a time. If we had a 50, I hope it's going to be more than 70. But even if it's 50, 60, a 50 to 60% effective vaccine is totally value added if you complement it with public health measures. So give you an example historically, David. If you look at measles, measles is really an amazing vaccine. It's 97 to 98% effective. So in effect, the only thing you need to do with measles is vaccinate people, because the high degree of efficacy, which gives an amazing degree of herd immunity to the population. Whereas when you have a vaccine for a disease in which you can do public health measures to mitigate against the spread, you put those two things together, and I'd love to have a 80, 90% effective, but if we get a 50 to 60% effective, I'll feel good about that. With regard to durability, that's a different story. No question about it that if you get a vaccine, you're going to at least have several months protection to get you through a season. If it turns out that you get more than that, well, all the better. If it turns out you need to boost someone, that's okay too. We can give a booster shot the way we give booster shots for other vaccines.
So as a practical matter, who's ahead in this race, as far as you can tell, in finding a vaccine that would be efficacious?
You know, it depends on what you mean by temporally ahead or efficacy ahead. There's no one that's ahead efficacy, because the proof of the pudding is that you need to do the large phase 3 clinical trial to determine efficacy and to confirm safety. There are a number of vaccines that have already entered phase 3 trial. There's one from England that is doing one in Brazil and South Africa. There is one that we started here in the 27th of July with Moderna. Pfizer started on the 27th of July. There are other companies that are going to be starting in the next month or 2 or 3. So you're talking about 5 or 6 or more companies, each of which have started at different times. We don't know which one is going to be better than the other. And you know what I hope? I hope they're all equivalently good, because that's what we need. We need vaccines not only for the United States, we need vaccines for the whole world.
Dr. Fauci, are you at all concerned that in the rush, and there's an undoubted rush to try to come up with a vaccine, we may run risks? As I have read about when the polio vaccine was first developed, the first round of that was really actually deleterious to a lot of children who became paralyzed and even died from it, and they had to go back and sort of reinvent it. Are you worried that we will forego some of the safety that we need in developing that first vaccine here?
We pay particular attention to safety, and the rapidity with which we are moving relates more to technological advances in how you can make a vaccine even before you start testing it, that makes me confident that we are going to do everything we can to determine safety. So when we talk about speed, it doesn't mean sacrificing safety considerations, nor does it mean sacrificing scientific integrity. It means we've been able to do things more quickly because of risks that we take financially. So when people hear risk, they think, oh, is that a risk to me? No, it means that you do things in advance of making investments in preparing clinical trial sites and even starting to manufacture the vaccine before you even know it works. When you do that, if it works, you've saved several months. If it doesn't work, the only thing you've lost is money. And since this is such an urgent situation, the federal government feels it's worth the financial risk to get extra months of it. So it's not going to be a risk of safety.
So, Dr. Fauci, as you say, we would like this to happen tomorrow. It's not going to happen tomorrow. In the meantime, we need to take a lot of activities that you've already described that we should be taking in terms of social distancing, wearing masks, and things like that. Should we have national policy that actually requires some of those activities more than just guidelines. And let me give you one, for example. It seems to me at this point, masks, everyone agrees if everyone wore a mask for some period of time, it would really help us in fighting this disease. Why don't we have a requirement nationally to wear masks?
You know, I mean, obviously there are some that will argue back and forth. I mean, for me as a public health official, obviously I would like the consideration that everybody wears a mask. We live in a country, as you well know, in which the states have a lot of responsibility. And there is pushback. And one of the concerns, I'm not saying it's the overriding concern, but let me tell you what I hear when people speak about this, is that when you mandate something, you're going to have to essentially enforce it. And will the energy that's put into enforcing actually be a distraction? Will some people push back more when you mandate? For me, I'm not necessarily think that that's the best route to go of not mandating it, but that's not my decision. The issue is if we uniformly and consistently give the message that it is extremely important for everyone to wear a mask, that could be as good as a mandate, because there may be some pushback about mandates. The bottom line is the vice president is now consistently wearing a mask. We've seen the president tweet about wearing masks and wearing masks himself. I think we have a consistent message right now.
Well, not to quibble, Dr. Fauci, but I saw a photograph of you with the task force in the Oval Office just yesterday. You had a mask on. Dr. Birx had a mask on. Most of the people in that room did not. It did not. You were indoors. It did not look there was 6 feet distance. What kind of message is that sending when people around the country see that photo?
Yeah, I know that could be a confusing message, but what I think people don't understand and don't appreciate, that everybody in that room has gotten tested for a coronavirus infection and are negative. See, that's different. And that's something that's not the real world, because people on the outside can't be getting you can't go in that room unless you're tested negative. And I tested negative anyway, but I wear the mask because I want to give the signal that there's no doubt that you should be wearing a mask.
Coming up, Dr. Fauci discusses the need for increased testing and whether that's a federal responsibility. This is Bloomberg. This is a special edition of Balance of Power with Dr. Anthony Fauci. I'm David Westin. Before we can fight the COVID-19 battle, we have to know who has it. And one of the toughest things to get on top of is the testing we need to know what we are fighting. Dr. Fauci says we're doing better, but we're not close to being where we need to be when it comes to testing. As I understand it, we're testing at something over the rate of 750,000 people a day, I believe. At the same time, the recommendation is we need to get those test results back within 24 to 48 hours to be effective. We're not close to that nationally. Where are we nationally in testing? What do we need to do to get to where we need to be?
Well, the people who are responsible for the testing, namely Dr. Admiral Giroir and his colleagues, they give some statistics that a substantial proportion of the tests come back in 24 to 48 hours, mostly 48 hours. There's a certain percentage that take 5, 6, 7 or more days. You're absolutely correct. And I can't credibly defend that and say that's a good thing. It's not, because if you have to wait that long, particularly if the testing is done to really determine if you are infected and would you be infecting somebody else, that's an unreasonable amount of time to wait. And it kind of obviates the underlying reason for doing the test, which means we need to do better. We need to get 95 or more percent, 99% of the tests that need to be done back within that period of 24 to 48. No excuses. It needs to be done.
Shouldn't that be done on a federal level as a practical matter? I mean, there may be problems in enforcing things like mask wearing and things like that. Why don't we have a national policy, a national approach to testing? We have money in the stimulus bill that's being debated right now on Capitol Hill for that. Are we doing enough as a federal government to fix this problem?
Yeah, you know, what we depend on here in the United States is the private enterprise, the various independent companies that make it and distribute it. And that's just the system, the way it works. I'm not sure. We do have public health groups that get testing from the public health system, but the ones that really drive it are the private enterprise.
And is that effective? Is that the way we're going to beat this thing, as you say, over the long time?
I mean, obviously we need to do better because, I mean, even though we are much, much better off now than we were in the beginning where we had some missteps, at the end of the day, when you make phone calls and you hear that it's taking X number of days to get back, it clearly means we need to do better. How
is President Trump getting his medical information as a practical matter? Because there seems to be some conflict on things like hydroxychloroquine, and not limited to that. Is there a vetting of the information that he has access to?
No, I don't know that because I certainly don't have privy to all of the input into the president. The only thing that I know is what we do, and we do that through the task force, through the vice president. The vice president then briefs the president, or like we saw yesterday, the president invited us all to the Oval Office to brief him in person.
So, Dr. Fauci, let's look into your crystal ball right now, and assuming we don't have an effective, fully effective vaccine in the next 18 to 24 months, what does a trading floor on Wall Street look like? What does a school look like? What does a public event look like?
You know, I got to tell you, David, I believe, and I sound like a broken record, which is good, because I want to sound like a broken record. And that is, there are things that we can do without shutting down the country that can get those numbers down to a manageable amount, that you could do things that would be very productive and enhancing of the economy. We should not think of either lockdown completely or caution to the wind. There's a middle ground that we can do of the 5 or 6 things that I mentioned to you that will allow us to prudently and carefully open up the economy. It's not all or none. I think there's a misperception that unless we either lock down or open up, there's nothing in between. There is something in between. The issue is, and I want to give this a point because I really am going to, over the next days to weeks, keep repeating it over and over again. We got to make sure that all the links in the chain of the United States of America as a country, bringing that virus down to a level that we can function, where we don't have to lock down, where we can revitalize the economy. We can do it, but all the links have got to work. You know, I use, you know, I'm trying to use analogies or metaphors that people understand. You could have a lot of people, a lot of states doing really well. When you have segments of the population that don't appreciate that even though they may not get sick from the virus, if they are careless and allow themselves to get infected, they're propagating the outbreak so it doesn't go away. And that kind of obviates all the good things that other people are doing to stay safe. I use the analogy only because I learned this from my daughter. My daughter, when she was in college, was on the varsity of a Division I crew team in college. And I used to go to those matches. And you're an 8-person boat. The only way you win the race when every rower on that boat is doing it correctly. You get one rower on the boat that either accidentally, as they say, catch a crab and go off, or not doing it enough, the boat doesn't win. So it's the same thing. We're all in this together. Unless we all do it and do it correctly, we can get it down to the point where we can open.
When we return, Dr. Fauci confronts the major issue of schools and when, if at all, during the pandemic, children should return to classrooms. This is Bloomberg. This is a special edition of Balance of Power with Dr. Anthony Fauci. I'm David Westin. As fall approaches, the question on the minds of many parents is, will my child return to school and will they be safe? The questions many teachers are asking as well. So we put that question to Dr. Fauci.
That is going to depend a lot on where you are. So the way I talk about it when people ask me is that you should have a default position of what's your fundamental principle. The fundamental principle is that you should try as best as you possibly can to get the children back to school for reasons that when they're not in school, it's deleterious to the child, both psychologically and maybe even for nutrition. And then there are secondary downstream ripple effects for families that might have to stop work to take care of the children. So the goal should be to get them back. But then you have to have a but or however. And the however is fundamental to everything is the safety, the welfare, and the health of the children, of the teachers, and secondarily of the parents who may be interacting, which they obviously will, with their children. So if you look at our country, it's a big country, and you have to have flexibility because nothing is unidimensional here. You have some parts of the country where there's very little infection, and without any punity, I mean, with impunity, you could open up the schools and no problem. We call them the green states. And then there are those that have some degree of activity in which you really want to do something like you're suggesting. Maybe a hybrid, physical spacing, masks, outdoor classes, whatever you want to do to mitigate any spread. But there are other areas of the country when at any given time, and it may be just temporary, where there's so much activity in the community that you really want to think twice before you start putting kids back to school. And if you're in that zone, you probably are going to have parents who are not going to want to bring their children back, or teachers who are not going to want to show up. So when you talk about schools, David, you can't say the United States is one place. It's multiple regions.
At the same time, how do we create a sense of confidence, as you say, in teachers, in parents, in students themselves, that you need to do these things, don't cut them short, but if you do, you're reasonably safe? Because it's two messages, actually. You can't forego them, but if you do, it's probably going to be okay.
It is, because often when you try in a way, I mean, take a look at some examples. There have been examples of schools that have opened where, on day one, you wind up having children infected. We're going to have a policy which is still now, and first of all, I think we didn't mention one thing that's important. The CDC has put a lot of work into giving guidelines about how one can mitigate the spread of infection and the transmission of infection in schools. I think people should take a look at those guidelines.
Dr. Fauci, Larry Summers, you know him, former Treasury Secretary, economist from Harvard, has said, actually on Bloomberg, that what we're doing essentially is launching thousands of cruise ships this fall with a bunch of 19-year-olds, and he's referring to the dorms in universities. Does he have a point?
Well, if not done correctly, that you could have, because when you congregate people together. But if you look at what some of the universities are doing, who are opening, a lot of them are doing something similar in some respects to what some of the major league sports are doing, where they're testing everybody once to get there and then intermittently surveilling and then trying to determine if you do get an infection, get that person out and put them in a sequestered way. So some colleges, as you know, are going online completely. Some are doing online for certain of the years of college and in person in others. And some are doing it completely open, but we're doing a lot of testing. Again, it's not one size fits all.
That concludes our special edition of Balance of Power. Be sure to tune into Bloomberg Television and Radio for the latest information, news, and analysis 24 hours a day. I'm David Westin, and this is Bloomberg. Stay safe.